Excel Rehab and Sports offers physical, occupational, and hand therapy. Being their best to make you better. There is a difference. It's their patient-first mission.
Welcome into the Patient First Mission segment presented by Excel Rehab and Sports. I'm Chad Dorsett, honored to be joined this morning by occupational therapist and certified hand therapist Doug Lauber. And today's topic is carpal tunnel syndrome. And Doug, what is carpal tunnel syndrome?
That's a great question. I see people in the community all the time and say, they were diagnosed or their doctor said that they had carpal tunnel and they don't really understand what it is. So what I'm going to do today is kind of educate you guys about what the carpal tunnel is, why carpal tunnel symptoms has a specific symptom or pattern, so that it gives you guys a better understanding. Because the best way to treat an injury or treat a problem is to understand why you have the problem, and then fix the problem. So we're going to start off by looking at the anatomy of the hand. And if you look at your hand and you go from your fingertips all the way to your elbow, and you think of a loaf of bread, okay? So at your wrist level, or 3/4 of the way down your arm, or down the loaf of bread, you pull a piece of bread out, okay? So now you're looking at the white part and you're looking at the crust all the way around. That crust represents your skin or the covering of the bread, and that white part is all the stuff that's inside there or inside the area of your wrist. Now, inside that area of your wrist or the white part of the bread, you have multiple tendons. And tendons are things that connect to muscle and then also connect to bone. So when the muscle contracts, it pulls on the tendon, and because the tendon is connected to the bone, it moves the bone it's connected to. So that's where your fingers move. Another thing that's inside that carpal tunnel area is a nerve. And this nerve is what we call the median nerve. And this median nerve applies sensation to the thumb, to the index finger, to the long finger, and even in some people on the inside of the ring finger. So when people say they were diagnosed with carpal tunnel, or somebody told them that they have carpal tunnel, what they're really telling me is that they're having carpal tunnel symptoms. And the reason being is because everybody has a carpal tunnel. You have a carpal tunnel, I have a carpal tunnel, all these listeners have a carpal tunnel. But when somebody says to me that they have carpal tunnel, or they were told they have carpal tunnel, what they're truly saying is that they have carpal tunnel symptoms. And what those symptoms are is that numbness of the thumb, index, long finger, specifically even, like I said, on the inside of the ring finger in some occasions. If the carpal tunnel symptoms are bad enough, you may even experience weakness. And what you're going to start to see is that big muscle on the inside of your thumb that allows you to touch your thumb to your small finger, you start to see that atrophy. And what atrophy means is you start to see it getting smaller and even weaker, okay? Those are in severe cases. Now, why do these symptoms occur? Well, the reason they occur is because the median nerve, because of some reason, is being compressed. So how I explain that is you have a light switch on a wall, and then you have the light itself. Well, going from the switch to the light is a wire. Well, that wire is our median nerve, which travels through our carpal tunnel. Well, if that wire is being pinched, or if that wire is being compressed, or that wire is being bent in a fashion that it doesn't want to bend, even though you turn the switch on, the light may light up, but because the wattage is not as strong as it should be, the light may be dimmer, or depending on the compression, that light may even shut off or not go on at all. Well, that's the same thing with the median nerve that travels through your hand. Depending on the compression will depend upon how much of a loss of sensation you have, or even how much weakness you have in your hand because of that compression. Now, even going on a little bit further than that, how do we get compression? Well, we can get compression because of prolonged positioning, and we can get compression because of swelling. I would say the majority of people that we see, they get compression because of both, or they get carpal tunnel symptoms because of both compression and because of swelling. Now, compression. How can we compress that median nerve and not even know it? Well, at night when we're sleeping, the majority of us sleep in the fetal position because it's comfortable, it's relaxing. And what that fetal position is in our wrist, it brings our wrist down into severe flexion, and we sleep like that all night. Well, that nerve is getting compressed all night. So before you know it, you're getting numbness and tingling, or maybe not even feel the tips of your fingers when you wake up. Because of swelling. Why does swelling occur? Well, it's just like if you go to an amusement park throughout the day, you have your feet swell because you're up walking all the time. Well, if you use your hands a lot, for example, knitting, sewing, typing, holding a drill, holding whatever. You know, if you do something for an extended period of time, your hands are going to swell. Well, because of that swelling, you're going to get compression on the nerve. Well, another common question I have is, how come my friend can do the same thing that I do, but he doesn't get carpal tunnel symptoms, and I'm getting carpal tunnel symptoms? Everybody's anatomy is different. Some people's carpal tunnel space is larger, and some people's carpal tunnel space is smaller. So if your friend has a larger carpal tunnel area, or that white part in the bread is larger than mine, I can do the same activity, and I may experience the numbness, the tingling, and even the atrophy where my friend may not. So what do we do with it? We have to optimize that carpal tunnel space, and we also have to decrease the inflammation in the carpal tunnel area. How we do that is through shaking our hands. I hear people all the time, they say, when my fingers go numb, I shake my hands and the numbness goes away. And the reason being is because by shaking your hands, you're compressing or you're contracting the muscles in your forearm, which then is pulling that swelling out of that carpal tunnel area, and the numbness goes away. Or I hear people say, I wear this brace that I bought at the local convenience store, and my symptoms have gone away. And the reason being is because to optimize that carpal tunnel space, that wrist brace keeps it in a stable position, and you don't go into hyperflexion or hyperextension, which then compresses that carpal tunnel area.
Well, Doug, what about Excel Rehab and Sports? How do they treat carpal tunnel syndrome?
There's a lot of things that we do. You know, the biggest thing is when they come in and they get evaluated by our occupational therapist, we look at posture, we look at swelling, we look at, you know, patient report, when they're getting the symptoms, when they're getting the severe symptoms, and do all sorts of objective tests on them. And with that, our occupational therapists are specialized in developing a treatment plan that's going to make those symptoms decrease and get better. The biggest thing that you listeners have to understand is that if you wait too long to get this type of injury or problem fixed, there can be long-term repercussions. You know, I've seen people where their nerve has been compressed so long that they lose feeling in their tips of their fingers, and they touch something and they burn themselves and they don't even know they burned themselves. Or in another situation, they have surgery to release that carpal tunnel, okay? And I'll explain that in a second. And their symptoms don't get better. And that's because the nerve has been compressed for so long. You know, you look at a garden hose. You know, your nerve is just like a garden hose. You hook the garden hose up to the house spigot, you turn the water on, and before you know it, at the furthest end of the hose, the water comes out. Well, if I put a cinder block on that garden hose for a month, for a year, at a month I take that cinder block off, that hose is probably going to get better, especially if it's a rubber hose. It's going to get better, and before you know it, that flow down at the bottom end of the hose is going to be just like it was if the cinder block was never on there. But if you put a cinder block on that hose for a year, that hose is completely compressed, and it will never come back to its original shape or size, and you will never get the flow of water at the furthest end, even if you take the cinder block off. So what I'm telling you, listeners, is that if you know you're having these symptoms, catch them early. There's reverse things that we can do to help you. And then in the worst case scenario, or in severe cases where therapy may not help, we can refer you to somebody or educate you on what to do next. Carpal tunnel is something that is growing. You wouldn't believe the amount of people that I talk to out in the public, or even going to these health fairs, or even these events. You know, they tell me they have numbness and tingling. You know, they have it at night. They don't really do anything about it, and now they have it at night and during the day. Well, if you can fix it when you first start having these symptoms, the adverse effect or the long-term effect is vastly improved.
And we're talking about carpal tunnel syndrome. And Doug, you had mentioned earlier about surgery. What are the drawbacks to having a carpal tunnel syndrome surgery?
Well, you know, the biggest thing is, you know, through the research, carpal tunnel surgery is very successful. And the reason it's successful is because the success rate is based upon what the surgery is designed to do. And the surgery is designed to open up the carpal tunnel space. If you look at that loaf of bread again, okay, and you have complete crust all the way around the bread, that is your carpal tunnel. In surgery, what they do is they take the topmost portion of the crust and cut it or take it out, all right? And now, instead of having complete crust all the way around the white part of the bread, you have a portion at the top where there is no crust. And the reason that this works or really helps with carpal tunnel symptoms or syndrome is because, just like I said, a lot of carpal tunnel is based on swelling and posture. Well, if there is no longer a crust or there is no longer a complete circle of tissue around your carpal tunnel, you can absorb more fluid and allow that fluid not to get trapped in that carpal tunnel area. So that's what they do in surgery. There's a transverse ligament that comes across the top part of the carpal tunnel, or the volar aspect of the carpal tunnel if you're talking medically, and they go and they cut that transverse ligament. what happens with that is that you're allowed to absorb more fluid. The nerve does not get entrapped, and I've heard of people say immediately their numbness and tingling is gone. They have no more numbness and tingling. My theory, obviously, I'm a therapist. I think the majority of people in the United States, in the world, would benefit from therapy. I believe in what I do. The majority of people have abnormal movement patterns. The majority of people have pain. The majority of people could benefit from therapy. But that's just my opinion. So I think if you catch it early, you can avoid these surgeries. You can avoid having long-term problems by just getting checked out and being aware of why you're having the numbness and the tingling. And that's just like all injuries. If you understand why you have something, you can fix the problem. And I would say the majority of people don't understand why they have something, or what they do, they go online and they try to educate themselves at why they have these problems and these symptoms. And to be honest with you, the majority of people I talk to, they say when they go online and they start investigating what's going on with them, it makes them more worried. It makes them more apprehensive. So it's good to get checked out by a medical profession and can tell you what professionally they feel is going on.
Something else that Excel Rehab and Sports prides itself on is offering hands-on therapy versus machine therapy. If you could talk to me a little bit about the difference there, the fact that you're going to have a therapist work with you and put their hands on you versus sitting you down at a machine and checking on you after about 10 minutes.
I love my profession. I love the world of therapy. And, in therapy school and in research and evidence-based practice, it is proven over and over and over again, manual therapy is the best way to restore function, to restore tissue length, to decrease pain. There's a lot of fads that go in and out. There's a lot of different tools that are out there, but overall, all in all, manual therapy has been that thing that is there year after year after year after year, research after research after research after research. So here at Excel, we pride ourselves in every patient that comes through the door gets an evaluation. Every patient that comes through the door, a therapist will manually work on that patient. Every patient that comes through the door will be educated on a good home exercise program. And we will stay in constant communication with them throughout the rehab process. We take pride in that. We take it very seriously, and we feel like Excel Rehab and Sports, hands down, throughout the community, provides the best patient care in this area.
And that is the patient first mission, and there is a difference. That's why Excel at Rehab and Sports is the best. Doug, we're out of time, but thank you so much for your time. I do appreciate all the knowledge that you've shared with us this morning in regards to carpal tunnel syndrome, and look forward to talking again real soon here on the Patient First Mission segment presented by Excel Rehab and Sports.
Yes, and thank you for those listeners that are out there. And if I can confuse you more about carpal tunnel symptoms or syndrome, just give us a call. Set up that free screen. Get in so that we can clarify some things that are going on or some confusion that you may have. Once again, thanks for allowing me to be on the radio. I just thank you guys a ton, and it's all about the community and getting people better.
Definitely. Listen, thank you so much. I do appreciate it. That's going to do it for the Patient First Mission segment presented by Excel Rehab and Sports. Special thanks once again to my guest, Doug Lauber. He is an occupational and certified hand therapist at Excel Rehab and Sports, which offers physical, occupational, and hand therapy, being their best to make you better. That is the Patient First Mission, and there is a difference.